Hello everyone, and welcome to the US Open Health Desk presented to you by Mount Sinai Medical Center. I am your host, Shauna Ryan, and joining us today is Dr. Josh Zeichner. Overexposure to the sun, unfortunately, increases your risk to skin cancer.
Skin cancers, they can be broadly divided into two categories. You have your melanomas and your non-melanoma skin cancer. Non-melanoma is then subdivided into two different types. There's squamous cells and basal cells. Those are really the most common ones that we see. So the basal cells look like pearly papules. They look like little whitish pearly bumps that are not healing and sometimes can bleed. Squamous cells are the ones that look like scabs that are not going away. And if you see new bumps like this that just are not healing up after 2 to 4 weeks, get it checked out.
So doctor, we talked about non-melanomas, but what about melanomas? What should we know about them?
Yeah, so for everybody watching, if you've heard nothing else, the one thing I will say is that melanoma can kill you, and you need to make sure that you detect it early so that you can take it out and cure yourself. Melanoma is a cancer of the pigment-producing cells in the skin. These are typically black, brown, blue spots that are new or changing. And when you're looking at yourself, there are some rules. So let's start out with the ABCDE rules. A stands for asymmetry. These are spots that do not look the same from one side to the other. They're asymmetrical. B stands for border. Harmless moles are spots that have a round, regular border. If you have a dark spot on your skin and it has an atypical border, if it has notches, it has bumps, it looks irregular, that's a cause for concern. C stands for color variegation, or differing colors. Normal moles have 1 or 2 colors, usually light or dark brown. Atypical moles, as I mentioned before, can be black, they can have white, they can have blue, light brown, dark brown. If you have multiple colors, then that's something to worry about. D stands for diameter. Any spot that is greater than the size of a pencil tip eraser is a cause for concern. For me, the D is almost the least important of these rules because I have found melanomas that are 2 millimeters, teeny little spots. Finally is E, which stands for evolution. So if you have a mole that is new, different, or changing, it just looks funny to you, go and get it checked out.
Thank you so much for joining us here at the US Open Health Desk presented by Mount Sinai.